In this video, we will see how integrative medicine works for allergic conjunctivitis. What is allergic conjunctivitis? Allergic conjunctivitis occurs when the conjunctiva, which is the thin membrane covering the white part of the eyes, and the inside of the eyelids reacts to allergens and inflames. It becomes inflamed and causes all the symptoms. Now, there are so many types of allergic conjunctivitis. Medically speaking, at least there are 5 types of allergic conjunctivitis which you can see now placed before you. I'm not going to talk about all these things because this is the work of doctors, but when I talk to people, I just explain them that there are variety of types of allergic conjunctivitis. Let us talk about the common symptoms of allergic conjunctivitis, because once we know that we have the symptoms, it is possible that you may be suffering with one of these types of allergic conjunctivitis. Now, what are the main symptoms of allergic conjunctivitis? The main symptoms are redness of the eyes. The eyes become red or pink due to inflammation of the conjunctiva inside the eye. There may be a lot of itching, a strong itching sensation in the eyes, and it is one of the most common symptoms. Patients, when they come to us, they say that they have a lot of itching associated with the redness of the eyes, and there will be excessive tearing of the eyes. Watery discharges will be coming from the eyes, and it occurs generally as a reaction to the allergen which is actually causing these symptoms. And along with that, the patient also will experience swelling of the eyelids or the conjunctiva. Sometimes the conjunctiva may itself swell, or sometimes the whole eyelids also will be seen swollen and puffy. There will be a lot of burning sensation in some individuals, and it can be a stinging kind of feeling in the eyes. Also, there will be a lot of sensitivity to light, and we call this medically as photophobia. The eyes may become more sensitive to light. The patient will not be able to tolerate the light, especially when the eyes are red, inflamed. He will not be able to tolerate the light, the bright light. And the discharges are generally a watery, thin kind of discharge. But remember, if at all there is a bacterial invasion and if the bacterial infection also sets in, then the discharge may become thick or sometimes pus-like. So whenever you see a thick discharge or a pus-like discharge coming from the eyes, it means that it's an emergency. You have to see the medical treatment, seek the medical treatment immediately, because there may be a possibility of bacterial infection and there may be a possibility of loss of eyesight. And the patient also talks about gritty feeling inside the eyes, as if something is stuck in their eyes like sand or grit. And because of all these symptoms, the vision might become temporarily blurry, or sometimes if the bacterial invasion sets in, the person may completely become blind also. Now, these symptoms can affect both or one eye, and they may vary in intensity basing on the severity of the allergic reaction. So a person may not have all the symptoms which we have discussed now. They may present with some symptoms. They may have a few symptoms, and over a period of time, the symptoms can become worse. Coming to the treatment of the allergic conjunctivitis. In allopathy, what do we do? First, let us see about allopathy treatment. In allopathy, what do we do? In allopathy, first of all, to relieve the gritty feeling and dryness or redness and the pain sensation because of the redness of the eyes, we recommend artificial tears. And the patient also will be recommended antihistamines, which will relieve the symptoms, and patient also will be given vasoconstrictors as required. There are some medicines called as mast cell stabilizers. These can be used. They give very good symptom relief, and painkillers can also be tried. In some extreme cases, corticosteroids can also be tried, and in chronic cases, subcutaneous injections of immunotherapy are traditionally used. There are some medicines called mucolytic agents which reduce the discharge and provide temporary relief. These can be used. And along with these things, if at all a person develops corneal ulcers, then patients will be given the required medicines to heal the corneal ulcer. And now, for severe corneal shield ulcers, the ophthalmologist will recommend surgical treatment, and the patient may have to undergo surgical treatment. How to prevent allergic conjunctivitis? Are there any methods? Well, there are some methods to prevent allergic conjunctivitis. The first among them is to avoid the allergens. Try to find out the allergen and then avoid it. There are some tests also to identify the specific allergen which is causing the problem, and the ophthalmologist or a physician or an allergist or an ENT doctor, any one of them will ask you to undergo the allergy test to help you to overcome this problem. And these tests are convenient tests, and they will be available at any established medical center, and they're available at our center also. And there are some medicines or cosmetics which can cause this kind of allergy, and whenever you come in contact with those things, you will develop contact reactions. So you should avoid all those contacts with medications or cosmetics which cause allergy to you. Coming to the homeopathic treatment, the homeopathic treatment for allergic conjunctivitis actually focuses on natural remedies in homeopathy which will help you to recover from allergic conjunctivitis. The most common remedies, few of them I will discuss. The most common remedies are Euphrasia, Apismel, Allium cepa, Netramure, Pulsatilla, Argentum nitricum, and sulfur. These are the common remedies which will help the patient to recover from the allergic conjunctivitis. When we talk about treating allergic conjunctivitis with integrative approach, we need to understand what is actually done in integrative approach. In integrative approach, we combine the strengths of both allopathy and homeopathy and offer a personalized treatment plan that can reduce the symptoms, prevent recurrences, and improve overall being. And this is done by using allopathy and homeopathy. How is it done? What is the methodology? In integrative treatment approach, the allergic conjunctivitis is treated combining both the allopathic and homeopathic medicines. And before we embark on treating the patient first will be diagnosed properly. The allopathic approach is first used to diagnose properly. The patient will be sent to an eye doctor so that they may examine the eyes and come with a proper conclusion and diagnosis. And the patient also will be asked to undergo the allergic test to find out what is actually causing the allergy to him. And as the patient is interested in homeopathy, homeopathic medicines are also given so that the symptoms may become better. The acute symptom management in this patient is done primarily with the allopathic approach using simple allopathic medicines which we have already described, and homeopathic treatment also will be continued to reduce inflammation and discomfort naturally. And over a period of time, maybe it will take about 3 to 6 months of time, or in some patients it may extend up to 1 year basing on the chronicity of the disease to overcome the symptoms and to become better. So in short, the patient may have to use medicines for about 6 months to 1 year to completely get rid of these allergic symptoms and from the allergic conjunctivitis. And most probably once the patient uses the medication for about 6 months or more, the patient will be requiring less amount of allopathic medicine, and over a period of time allopathy can be stopped and homeopathy also can be stopped. This approach of integrative medicine is the best approach for the cases of allergic conjunctivitis, where the patient will get betterment with allopathic medicines. The acute symptoms will be tackled easily with allopathic medicines, and the patient will have a better quality of life. And along with that, the The homeopathic medicines are used for the chronicity of the disease, and over a period of time the disease will come down and the patient can become completely rid of the disease. And now the patient may not require any allopathic medicine, may not require any homeopathic medicine also. The patient can recover completely. This is the advantage of integrative treatment with allopathy and homeopathy.